Is that too loud? It's good? It's perfect. Thanks for being patient. I'm sorry about the time snafu. But hopefully you got a little bit of my background. I'm not very good about talking about myself, so I'll give you a little bit. Besides being a mother of two grown children, 25 and 22, I am also a very passionate provider in family medicine and functional medicine. That has lent me to some time and some experience at Cleveland Clinic with Dr. Mike Hyman. I, and Dr. Hanaway were the primary providers setting up the Center for Functional Medicine starting in 2015. So prior to that, I was a naturopath first, and then I went to med school. And all of that really was because I had a personal health journey that wasn't really getting adequately answered or treated or taken care of using the typical medical approach. And so that just lent me to reaching out and getting more and more into more of that integrative holistic mindset. And so then as I got better and my health was optimal, then I went off to medical school. So then I bridged the gap with functional medicine. So that has allowed me to meet many wonderful, brilliant minds, one of which you all are very familiar with, and that's Dale Bredesen. He's a fantastic person, but he's also a brilliant mind. He and Dr. Perlmutter, I don't know if you're familiar with Perlmutter, but Perlmutter is another one that I've worked well with and actually know his team very well that's taken over his practice in Naples. But they have been sort of the forefront in the cognitive decline or the Alzheimer's or the dementia world, that neurodegenerative world, the world that we would all love to prevent or at least go through gracefully. And so when I got wind that you all were students of possibly the Dale Bredesen protocol, I said, ooh, I love talking about that. So she was eager and happy to invite me out here. So thanks for giving me your time and your attention. And I guess I'm a little tardy, and I apologize. So what we'll do is we'll run through the slides, hopefully. I'm currently practicing in a new practice in Bentonville. I moved here. We started about 2 years ago. The dream was to have a practice where I could blend my functional medicine with my family practice or my primary care. And so I have a team that includes a dietitian, a health coach, a physical trainer, and then a couple of nurses and an MA, and so myself and a new provider starting in May. All of us are functional medicine trained and functional medicine minded, integrative holistic approach, and we do primary care. So that's one thing that I found when I was in primary care in Oklahoma for about 7 years, is a lot of my patients really embraced that more holistic approach, but then they would go out somewhere else to a specialist or somebody, and that would get sort of muckled up over there, and they'd get confused, and then, or they would go and do a lot of holistic medicine, and then they'd come to a primary care, and they'd roll their eyes, or their hair would light on fire when they mentioned something that was more alternative. And so I felt like that bridge was missing, so my goal was to bridge the gap. And so now here we are in Bentonville, over by Premier Dermatology, if you know where that is. So we have a nice little team and a nice practice that includes a spa facility and a gym, and so we're trying to really encompass that community holistic approach. So that's what Salt Health is. So today the title I thought was appropriate, Staying Sharp. We all would like to do that, no matter how old we are or how young we are or how mature we are. We still want to be at the top of our game. I'm going to have to keep looking back. I'm sorry. I'll do this about that. So what I'd like to do is just a little bit of a brief introduction about what functional medicine is in case you're not familiar with that term. It's getting a lot of buzz these days, and sometimes I think it's taken out of context. So we'll talk a little bit about that. And then ultimately, what does it mean? What is cognitive decline? What are the types of that? And then how can we actually slow it down, stop it, or reverse it? And if you're students of the Bredesen protocol, you have a lot of knowledge, probably a lot more than most of the people outside of this community. But I think there's some new information I can shed light on, and that really has to do with genomic testing, as well as some of the neuronutrient information. So I'll share some of that with you today. Statistically, I don't need to tell you all of these. It makes me sad. It's kind of boring. It's kind of drab. Oh, hi, Tim. This is part of my team back there. Everybody say hi to Tim. Hi, Tim. Tim, we got the times mixed up, so when I came in the door, there was a beautiful greeting out front, and they rushed me in here, and I started really fast. Yeah. So anyway, so what I was saying about this is we already know statistically we're not doing well in the healthcare arena in the United States especially. We are a very top-notch nation that has great technology, great systems informatics, lots available to us, wonderful freedoms, but we're kind of lacking in our progress in healthcare. And so one of the things that we can see by the statistics up here, about every 40 seconds someone's going to have some kind of heart event. You have tripled our number of Alzheimer's patients by 2050, which means it'll be about 45 million of the United States will have some form of Alzheimer's disease, that of which you all, wonderfully, are taking strides to prevent. So if we have a problem, we need to fix it. So what's the solution? Well, that is actually how I ended up at Cleveland Clinic. I was enjoying my sweet little practice in Grove, Oklahoma, where I was doing primary care and functional medicine blend, and it was lovely. It was great. I loved what I was doing, but they found me because I had done research in my past, and I was teaching at the medical school, and I was also doing a practice where I blended the two with insurance, which is uncommon and really not heard of. And so they said, that's what we want to do. You're already doing it. Come up here and see us. And I thought they were going to let me go to Florida because it's a lot warmer there than Ohio. But dang it, it was Cleveland. So I headed up to Cleveland with my son and my husband at the time. And we made a life there. And I learned a lot. And so that was the Center for Functional Medicine. So functional medicine is really, truly one of the first answers to our broken healthcare. We are currently, we use the analogy of a tree when we talk about functional medicine. I should explain that first. So when you go to the kidney doctor, the nephrologist, maybe you go to a cardiologist, maybe you go to a pulmonologist, you have a lot of ologists on your tree. That's the top of that tree where all the leaves are sticking out and the branches up at the very, very top. That's the tree. If we're using the tree analogy, you have wonderful specialists that you go to, which is awesome when we need them, and I refer to them because that's what we need. We need a good diagnosis. We need a sound platform. We need to know what we're doing. Then you have the trunk of the tree, which unfortunately in medicine, we have no trunks of the tree. We just have leaves and branches. And as you know, when you take a tree, if you lop it at the trunk, then the tree doesn't live very well. So that's kind of what our system is doing right now. We have siloed everybody's symptoms into ologies, and we send you off to have a lot of doctors. We forget about the trunk, and the trunk is what's making it happen? What's triggered this event? We forget to ask those questions. That's what functional medicine does. So functional medicine takes care of the trunk and the roots. The roots are going to be things that you can modify. That's going to be your sleep. You know, well, sort of, you can. Your sleep, your spirituality, your community, your, like your education, your mind, neuroplasticity, all the things that we can work on, your exercise. So that's going to be the roots. That's what keeps that tree strong. All the things that you do on a day-to-day basis to engage in activities and to be with people and to sleep well and to bond and so forth. The trunk is the middle where I come into play, and I'm going to say to you, oh, so you have kidney disease. Oh, so you have heart disease. Oh, so you saw a GI guy because you have IBS. Why do you have all of those, and how are they related is the trunk. That's my job. And so in functional medicine, we treat the bottom half of your tree. So that's the analogy of functional medicine. And a lot of times we use analogies and pictures, but I think sometimes they speak more than words. So if we treat one thing, or we plug one hole in this bucket because we fix your heart disease, but I don't treat all the rest of it, are you going to do so well if you're the bucket? No, you're going to lose all of your water. It's going to leak out. So sometimes, especially in the Alzheimer's cognitive impairment or dementia process, there's up to 25, maybe even 30 causative agents for one person's presentation of memory loss. So if nobody's asking the question, well, how'd you get here? What happened to trigger it? When did it start? What's making it what keeps it going? Maybe there's something you're being exposed to that's making it worse and worse and worse and worse. So if nobody's asking those questions and plugging those holes, your bucket will continue to leak. And I'm from Oklahoma, dear Liza, dear Liza, dear Liza. You know that song. So we've got to plug all the holes. Also, we have currently been approaching a disease process with the pill for an ill kind of attitude. You have an ache, I'm going to give you some meloxicam because that's a really good anti-inflammatory. Oh, the meloxicam caused the GI bleed. Huh, now I'm going to give you a PPI. Oh, now you're on protonics. Isn't that fun? Now your bones are breaking because you're on the protonics, so now I'm going to give you, let's see, Boniva. That sounds like a good one today. And so forth, and so forth, and so forth. So the idea is to kind of step back and say, this is not working. And about in 2014, actually, the CEO at the time of Cleveland Clinic was Toby Crossgrove, and he was approached by the president at the time and said, the system is broken, we need some help. We want you to go to the VA, revamp it, it's a controlled environment, try to see if you can figure out what we're doing wrong, because we are spending way too much money and people aren't getting healthier. He said, actually, I have a better idea. I met this really crazy guy. His name is Mark Hyman. We're going to bring him here to Cleveland Clinic and start the whole functional medicine thing. And guess what they said? Okay. But you have to do some research studies to prove that it's going to work. And so that's where we were born, the Functional Medicine the Center for Functional Medicine at Cleveland Clinic. So the idea and the stuff that I practice started many, many, many years ago, but it's now becoming really cool and popular because the system is broken. And I just like it here. I'm from Oklahoma, and this is sort of my family's area, so I came back here, and I brought it with me. So you all are familiar with Dale Bredesen, yes? Yes, we have some very strong students. Good. So he's one of the first physicians and scientists to actually say, hey, we aren't doing really well when it comes to losing our memory and the way we approach this. Maybe we should look at it a little bit differently. So as you all know, typically when you start to lose your memory or things start to slip and you're walking around with the pad and writing down things to remember, and then you think, where did I put my keys again? So those are the early stages of that memory decline. As we continue further, it actually can get pretty severe, and then you need a lot of full-time care. It can ruin relationships. It's a big strain on people and our environment, but also on the healthcare system. And that is as you progress through this cognitive decline process. Well, Dale Bredesen said, we're doing something wrong. Namenda, Aricept, those are all we've got. And for a high society, a first world country, that's not great, because once you've maxed out those two medicines, we don't have anything else for you. And that's sad. So what we've done is a group of people that have the same mindset, we keep trying to say, how do we optimize it? How do we slow it down? What are we missing? How do we step back and look at it with a different bit of lens? And so since you all are pretty familiar with his protocol, the idea here is that he looks at several different areas in a person's life, and he tries to optimize those. So if you're not moving, you're not, I'll say the bad word, exercising, then we're going to get you moving. If you're not eating healthy and you're living on Pop-Tarts and Twinkies, we're probably going to shift that as well. Don't laugh, people do. And then I used to think Pop-Tarts were healthy when I was younger, so I'm in that category too. And then sometimes I've had patients actually that were exposed to heavy metals. Is anybody checking for heavy metals if you've lost your mind or if you're not remembering things? Nope, they don't usually ask you that question. What if you have been exposed to a lot of pesticides, or you've been spraying your yard, for weeds? That can definitely affect, especially the frontal lobe. So you'll get Lewy body dementia a lot of times with that exposure. So anyway, there's a lot of different areas, and you want to approach those, each categories, and optimize them for the person so that you can slow down the process. What is the process of losing a cognitive decline? Well, it starts in a lot of different areas, but the whole point or the whole way that we present with neurodegenerative changes or cognitive decline is that our body is overreacting to something. It's actually doing what it's supposed to be doing, protecting you, but unfortunately it kind of got out of control, or it's protecting you for something we haven't identified. So our job is to identify it and ask the right questions. You may present one way, I may present another way, and we have two different causes, but we have the same general presentation. So I may come in and say, I said that wrong. We may present the same way, but we may have two different reasons for the presentation. And so the idea is to ask the right questions, go through that wheel, and then also add to what we're going to learn today is genomics, add that into it to make it very individualized. And so if someone comes in and they say to me, I'm not remembering very well, and the family's a little bit concerned. I got turned around the other day. The first thing I'm going to do is not put them on Aricept. I'm going to ask them their history. And a lot of times their history includes things like irritable bowel syndrome, constipation, loose stools, sudden changes maybe when they were in their 40s. My bowels started changing. I had a lot of bloating, blah, 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 blah. But it was normal. It becomes the norm. We all could be on Miralax, and that could be normal. It's not normal. So something could be wrong in the gut. Well, how does that relate to the brain? We have a permeable membrane. We have a membrane that's in the gut. That same membrane is also in the brain. So if you have leaky gut, it's a good chance you have leaky brain. Now, it's not truly leaking like that bucket I showed you, but there's a sense of it where you have an increase in permeability, creating inflammation when you eat or are exposed to something. That also drives inflammation in the brain. The body responds to it, makes more plaque, and the cycle starts. So that's the idea. There's a lot of things that can tie into it. What if you were exposed to mold? How many of you know that mold exposure is neurotoxic for some people? Yeah, so there is such a thing as mold illness. And if you don't ask the question, have you been exposed to mold? Do you smell mold? Is it musty? And boy, I'm like a little mold bloodhound. You come in my office and I go, you kind of smell like mold. Don't be offended, but I'm going to test. Because it could be. There are certain forms of mold, especially man-made mold, that are neurotoxic. And if you remove the patient from that home or you clean them up, help the system clear out that reaction that it had to it, suddenly they are clearer-minded and they're functioning better and feeling better and they're not as paranoid and they're not as anxious. Amazing. What about viruses? All of us have been exposed to viruses. All of us have had, exposure to Epstein-Barr for the most part in the United States. That is the monovirus. You may have had mono when you were in college, didn't think anything of it. It can lay quiet and dormant until the immune system decides to get out of whack or get suppressed, and all of a sudden it's raging. Typically in medicine, the only thing we think of when we think of Epstein-Barr is lymphoma. Well, now we know it also can be a trigger for Alzheimer's, dementia, any neurocognitive process. Any inflammatory process. COVID has also been another one that we're watching really closely because it's doing similar things that these other viruses do. What about tick disease? Anybody been bit by a tick? I mean, if you live in Arkansas, although according to the CDC, we do not have ticks here. How many of you believe that? Anybody been outside lately? Just kidding. No, there are a lot of ticks here, actually. So tick illness can sometimes be missed. And actually, they just released a great journal where a scientist just reported they've done autopsies on patients with Alzheimer's disease, and they found spirochete from the Borrelia species. That is Lyme's disease, in case you didn't know. So interestingly enough, we always thought that once you treat it for 7 days, we're good to go. There's a lot of controversy in the tick world about that, but now they're seeing actual little spirochetes. The only other thing that does that is syphilis. They look a little bit different, but similar. And they were finding the Borrelia Lyme disease in the brains of many of the Alzheimer's patients that they were doing autopsy on. So if your physician doesn't ask you if you've been bit by a tick in your history, then it's something that should be questioned. What about environmental pollutants? So POPs, that's a cool name, and I'm not talking about the soda pop. POP, that is persistent organopollutants, things that actually persist in the environment. We are commonly exposed to. If you excrete them really readily and appropriately, they're really not a big issue, which is why we can get them approved. They're okay to use in the environment, but what if you don't excrete them? What if genomically or genetically you have a problem with that? A good example of that is a case study that was presented when I was learning genomics, which we'll talk about today. And he was a surgeon, a great surgeon, on the top of his game, early 50s, suddenly started just going down here, was messing up, surgeries, kept forgetting what he was supposed to ask for. They actually told him, you need to step away. He declined rapidly. They were selling their home. They were liquidating their assets. They were getting him into a nursing home. Like, he was just going downhill fast. And they just said it was rapid progressive Lewy body dementia, so frontal lobe dementia. His wife really wasn't settling for that. She wasn't convinced. Something didn't seem right because he didn't have a family history of it. And it was a sudden onset. It was progressing over a year or two. And so she took her husband, and they did a genomic test, which was really the meat of what we're going to talk about. So I better speed it up, shouldn't I? Anyway, the point being, they did this genomic testing, and the doctor sat down and said, you have no genes for the Alzheimer's or dementia process. 0, not one. So you really shouldn't have that diagnosis. What is going on? You do have trouble, however, clearing pesticides, insecticides, and plastics, any exposure. And the wife was like, oh, no, we are organic. We don't do that stuff. Blah, 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 blah. 2 visits go by. The doctor's like, yeah, I don't know. I mean, that's the only thing I can come up with. And he said, both times, by the way, the patient said, yes, I do. Yes, I do. And the wife's like, no, you don't. He doesn't know what he's talking about. And he said, yes, I do. And finally, the doctor allowed the patient to speak, and he said, I have been spraying our ranch yard, which they had been going to every weekend for over a year. He had been spraying on Saturday mornings and Sunday mornings before she woke up for weeds. And for him, not being able to clear it, he was inhaling it, ingesting it, and that was just enough to kind of tip him over the edge. So what they did is they did a urine test to see if he spilled those sorts of organic pesticides. He did, very high levels. They did enough chelating that he was able to go back to his job. And they video commed him into our conference, and he was speaking and talking about how he almost lost his career and blah, blah, blah. So sometimes the right questions can change someone's trajectory drastically. So that's organopollutants. Then they talk about nutrition. You all know it's very important to be eating, well and clean and lots of veggies and phytonutrients and all that's wonderful. Some people are really big on ketosis, and some people that's great, but what I'm learning is if you know their genomics or their genetics and they don't do well with ketosis, it actually can be worse for them. But some people, it's amazing. So if you don't have genomic testing, it's a sort of guess and it's worth trying. But if you don't have someone improving pretty quickly, then you know it's probably not the right one for them. So ketosis is interesting. Gluten, we all know that gluten in 100% of the population, if you are human and you're not another sort of species, if you are human, then you have an increase in permeability of the blood-brain barrier and the GI tract for an X amount of time every time you eat gluten. So it doesn't matter if it's bad for you per se, like it doesn't make you have bad symptoms, but if it increases permeability and it allows more of these potential toxins or bugs or whatever the body is fighting against, it upregulates all that inflammation for anywhere from 45 minutes to days, then you could see that that could potentially be a problem for the patient. So it doesn't mean that there's celiac or gluten's all bad. We don't have to get on that band. But if you know you have a process where inflammation is a center, and there's one thing you could control, and you know that 100% of us respond, why would you not remove it? Is my question to people. I'm not the bad news for gluten. I'm just saying if you're really trying to get well, take it out for a while and see what happens. What about vitamins? Well, vitamins are really important, and we do a lot of testing for vitamins in my office. We look for, fat-soluble, water-soluble, the whole kit and caboodle, minerals, amino acids, the whole 9 yards. But there's a lot of really good recent literature about IV NAD. If y'all haven't heard about it, it's kind of the new buzz because now dermatology's got a bunch of papers on it, and it supposedly whitens your skin and makes you look all young. I don't know about that so much, but they're really into it. But the cool part is they actually have, oh my gosh, I printed them just in case y'all are going to be like super academia on me. Look at all these studies for NAD for specifically Alzheimer's disease. So cool. Yes, some of them are mice models, and you're not mice. I get it. I've heard that before. Well, I'm not a mouse, so. So the point is it actually slows down and can reverse the aging process, especially when it comes to plaques and tangles, because it plays a key role in cellular energy with the mitochondria. Mitochondria are like our powerhouse. They make all of our energy, and they help with detoxification, and if they don't work, we don't work. So IV NAD, you can actually have people, doctors, more integrative providers that are able to prescribe that. And it's actually a B3 family, so it's the vitamin B3 niacin family. Then also we have glutathione. Are you guys familiar with glutathione? It's like a wonderful, wonderful nutrients. So it's made in the liver. It's like, it's an antioxidant. It's like your Pac-Man. It's one of the most readily available, well, we hope, nutrients in the body to help clean up mess. So if you have heavy metal toxicity, one of the first things we look for is glutathione levels. And you can test it in the blood, super easy. Doctor can write for a glutathione level, and if it's low, you need to replace it because it is one of your best cleanups. So Pac-Man, just think about Pac-Man gobbling up all that junk. Glutathione is one of your winner chicken dinners. And then your B12, interesting because B12, when we talk about genomics here in a second, you're going to find out you can be low in B12. I used to be a chief medical officer assistant in a nursing home in Grove. So had a lot of patients there that were more mature. And so they had, when I looked through their labs, I started noticing a trend that one of their values of their blood count was low. So I started checking B12. And when I started replacing B12, I actually got in trouble. Really. I got called in to meet with the director, and I had to bring my hospital CEO or his stand-in at the time, and we had a little sit down, and they said, you need to quit ordering B12 because people are getting so well, we don't have the staff to keep up with the activity. No lie. I will go to my grave just baffled by that whole conversation, but literally said, could you please just slow down? I said, let me just get this straight. You want me to stop testing for B12 and giving them B12 because they're getting better? Just to clarify. And he said, well, I didn't really mean it like that. I just mean, could you just slow it down a little bit so that, we don't have the staff to keep up with the activity. So B12 is really important, but I also have learned more in the last couple of years that just because I give you B12, say you're low, which would be awesome, mental clarity, nerve tingling, burning in your toes and feet and hands, numbness and paresthesias when it gets numb and tingly. Sometimes that's B12. Hypersensitive skin, if you ever have someone, you touch them and they're like, God, dang, that hurts. That's hypersensitivity. Sometimes that's B12. But interestingly enough, just because I give you B12, maybe I didn't give you the right kind of B12. Maybe you're a poor methylator. This has to do with genomics here in a second. And so maybe it's a hard time converting that B12 into the kind your body needs. And then you take it up one more notch that I've learned recently, and what if you can't take that fancy form of B12 that I've worked so hard to order you and give you? But what if you can't cross it across the blood-brain barrier because you have this funny little genomic mutation that doesn't allow that to happen? So as your time goes and your B12 declines, you're getting lower and lower, your brain's getting fuzzier, you're getting slower with your thought process. Someone does a great job of giving you B12. It helps a smidgen, but not great because you're not transporting across the blood-brain barrier. So actually those patients do really well with injectable B12 in the fancy form. And it is crazy, the difference. So that's another fun fact. Vitamin D, same thing. I can give you a ton of vitamin D, your blood levels come up, and then I take it away and they plummet back down really low. Well, we all know that vitamin D is an amazing nutrient, actually a hormone, helps us fight off COVID, helps with bone health, helps with mood. If you know anybody that has seasonal affective disorder, so when in the wintertime they get crabby, that's more of that. That's a low D. If you have bone pain, remember when your kids were little and they said, I hurt, and you said, oh, it's just growing pains? Well, when you have low vitamin D, if the D is not holding calcium in the bones and the body lets the calcium go out, the body has to replace that with something, so it brings in a lot of fluid. Well, when a fluid comes into a bone structure, it makes the periosteum, the covering on the outside, swell. That hurts. So osteomalacia, low vitamin D, they used to call it rickets. Remember that? Low vitamin D can often be a cause for bone pain, not just mood disorders and immune system being low, but also bone pain. And interestingly enough, I can give you a ton of vitamin D, and if you have a genomic variant, which we're going to talk about, called GC, you don't really take it into the cell very well. So having someone get your level up and then yank it away from you is actually cruel. So that's why we have to know that about the patient. So these are all fun little things that we've learned and ways we look. So we can test for all of this stuff. It's not just me out there willy-nilly guessing, asking wonderful questions, but actually you can test. I don't grow out your blood and check Petri dishes, though. That's not my job. Genomics. So what is it? It's not the same as genetics. Genomics is a small little tweak in the DNA. We don't care about all the fancy jargon. I'm from Oklahoma. I can't even say the big words. So it's this small little tiny tweak in the DNA that makes things not work optimally. Could be faster, could be slower, could be one day the other way. Just doesn't work like it's supposed to. And so what they've shown is that a lot of these genomics, or these funny little tweaks in the DNA, can actually predict whether or not you develop something if you're exposed to the right ingredients. Okay, so APO4E, some of you are probably familiar with this gene test. This is the one that everybody talks about being the most important for Alzheimer's disease, but it's not. We've learned in the last year or so that it is absolutely not. It has to actually be turned on. It does play a lot of roles, by the way, and something you should know about APO4E. If you have the APO4E gene, and you have 2 of them, you are at a higher risk for developing potential neurocognitive decline, really because it affects like a lot of other inflammatory processes. So put out the fire so this thing doesn't get turned on. The other thing is, if you have this gene with that gene, then your risk goes up even higher. But if you have ApoE4 by itself, it doesn't really mean that you have to have a bad outcome. It just means you probably need a better, healthier lifestyle so that you don't turn it on, so it doesn't get bad. This one here actually has to do with turning on the actual switch for APO4E. So now we've learned more and more and more. Now we're starting to say, well, it's not as easy as we thought it was. So a lot of people are really big into the APO4E, but now we know there's so many more parts. What about the TOM40? These are the ones I was telling you about that surgeon. He didn't have any of these, none, zeros. So you got someone in there that they've diagnosed with progressive aggressive Lewy body frontal lobe dementia, going to the nursing home, in diapers. He's not doing well. He was a surgeon 3 years prior to that. He was doing major surgeries. And here he is sitting in an office, and the doctor says, you don't have any of these genes. Like, I don't understand. This shouldn't even be possible. So that's what made them investigate reasons and their causes for his presentation. So he didn't have the TOM40 gene either, so his mitochondria didn't get plugged up. So now we got one that turns it on, one that plugs it up, one that makes a mess. This is the make a mess one. So now we've got a messy room, we got junk everywhere, we got pieces that are getting on and off. So now you can see why there's more parts than just one little thing that can turn on someone's cognitive impairment. What if you have a lot of inflammation? What if you have this genetics? This means that you're going to have way more inflammation when you get COVID, or if you get the flu, or if you get a cut on your knee. You may have a lot of inflammatory response, but you get way worse, and suddenly you can't remember things, you're moody, you're cranky, you're whatever. It's because you have a tendency when you have inflammation in your body to get your brain on fire, so to speak. So some people, that is the reason, and we can do a lot to change these. That's the whole part about genomics, is we can actually modify them if I know what they are. For instance, that's what I was going to say. Oh, that's not right. Back up. You can do lion's mane tea. Have y'all ever heard of lion's mane tea? Yes, we have some yeses. So lion's mane tea actually slows down or alters tumor necrosis factor alpha, that TNF, that inflammatory one I just showed you. It can actually slow it down or alter that pathway by about 60% if taken on a regular basis. That's a lot. If I have brain on fire and I need to put it out, bring it on. I'll take some lion's mane tea. So it's made from a mushroom. Some other things that we can do actually would include ashwagandha. Anybody heard of ashwagandha? Yeah. So ashwagandha is an herb that has actually been studied and compared to Prozac for anxiety in higher doses. So when they did the study against Prozac or fluoxetine, which is used for anxiety, they used ashwagandha, 600 milligrams, 3 times a day, and it was equal to that of a 40 milligram Prozac. So it helps with stress. It helps lower cortisol. And so when you lower cortisol, for people that cortisol is the big driver for inflammation, it can be pretty darn profound. These are things that you can get from, prescribers, from people that have them. You can get them from the health food store. Just make sure you get quality. That's my only big beef. One thing I will say about ashwagandha, don't just go out and buy it. If you are prone or sensitive to nightshade vegetables, anybody sensitive to nightshade vegetables? Okay. Just be careful with ashwagandha because it is considered a nightshade, and that can make joint pain worse for some people. So it's just something you want to be aware of in case it does happen whenever you when you try it. What about capsicum? Anybody know what capsicum or chili pepper, cayenne pepper? Anybody know what that is? That also helps us, and it helps with the cleaning up process. That Tom 40, the one I was just talking about where it gets the pores all mucky, that one actually has been studied, and you can add capsicum and curcumin, turmeric. Both of them also can alter that pathway. And also with the inflammation, curcumin was really studied in a lot of things. The NAD that I was talking about, IV, also can help with the mitochondrial one. So any of them that say mitochondria, you think of NAD. So anyway, there are a lot of potential supports that we can add into someone's protocol, especially if we know and identify those specific genes. So I'm going to stop. I made it I made it short because you all had been in here a lot longer than you probably expected. But bottom line, just start looking into the root cause. Take it one step up. Find a provider that's really savvy on this stuff. Ask about genomic testing. It's really important. I will say one thing I have about genomic testing is that there are all kinds out there. You all have probably heard of 23andMe when it came out. You can buy it at Target now or something like that. 23andMe was one of the original genomic tests available to the public, and I did use it back in 2010 or so. But it's so old and antiquated that the testing is not really correct. There's a lot of holes, a lot of things missing. They've further progressed in the last, 13, 10, 12 years, that they've learned so much more that really misses a lot of it. It gives a little bit of good information. If someone has it, I still look at it, but it's really not a complete picture. You also want to find someone that does genomics, and they do it with a company that you trust. You want to have cutting-edge testing. You want to make sure that the person's autonomy is kept. You don't want to have a name associated with your DNA test or genomic test. I'm not a conspiracy theorist, promise. But I also don't want someone coming back and saying, you can't get this because we saw this test and blah, 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 blah. So I chose a company for our practice that does not do that. You have a number that's your barcode number, and that's how you're tested and associated with. It's a cheek swab, it's a spit. A lot of these things that I mentioned today can be done in the blood ordered by a standard primary care physician. So anyway, I'm going to leave it for questions. I thought maybe if I hurried through, you might have questions.
Also, there's a lot watching TV, so do you mind repeating the question after they ask it?
Yes. So I've been advised, since there are a lot of people on the TV version of this talk, to repeat the question. So if anybody has any questions, I'm open for questions now. If not, this will be awkward. Just kidding. Just kidding. Yes, ma'am.
With Alzheimer's, have you ever had any experience with open heart surgery causing Alzheimer's?
Oh, this is a beautiful question. So she said, with Alzheimer's diagnosis and an open heart surgery, have you ever seen or heard of any correlation between the two? Did I get that right? So interesting. I stopped putting genomics because I thought you would start looking like this, with that glassy look, because there's so much. But there's actually a genomic SNP called BCHE. Don't need to remember that. Point being, when you're exposed to certain types of anesthesia, a very large portion of people with that genomic SNP will come out of surgery with irreversible cognitive decline. So yes, ma'am, there is a definite correlation between, especially if they went in with that APOE4 gene, not knowing it, but if they did have it and they get exposed to that and they have this other funny little SNP, then yes, the risk of coming out of surgery and having irreversible, unfortunately, cognitive impairment, Alzheimer's dementia, or it getting worse is very common. I was a hospitalist for many years, and I didn't know all of this information, but looking back, I sure wish I knew, because I had a lot of patients and family members that were saying, Dad just came out of his knee surgery and he's not the same. When's he going to get better? And we would discharge them home, hoping they were going to get better. But as a primary care physician that saw them outpatient as well, I saw a lot of them didn't get better. And I didn't really understand. I thought maybe it was the stress at the time of the surgery, and then they just sort of went downhill. But now I know there is a definite correlation. And for people that know their genetics, like if I do your test and you had that gene, I would tell you what forms of anesthesia to avoid, so you did not go into surgery and come out with that bad outcome. So that's really important. Great question. I did not pay her or prompt that. That was excellent. Thank you.
Well, I had a husband that happened.
So you know firsthand then, right? Yeah, yeah. And that's really not normal. So you know there was something different there. Yes, ma'am.
Give us some examples of your nightshade foods that if you're allergic to, you shouldn't take the.
Ashwagandha. Okay, so she's asking examples of nightshade vegetables in case they wanted to try the ashwagandha herb for anxiety or for even to help with plaque reversal or maintenance. Types of nightshade vegetables, obviously better answered by my dietitian, but I'm going to give it a whirl. Be peppers, eggplant, tomatoes. Anybody else got some more that I forgot? Potatoes. Yes, I knew there was a big one. Thank you. So if you're really sensitive, or if you notice that when you have a salsa day, 3 days in a row, your joints flare up, you might be a nightshade sensitive person. And sometimes we don't know until we've ate potato soup 3 days in a row and then went for Mexican, and then you're like, why am I hurting so much? That's often a clue. Yes, ma'am. Yeah, I think it is actually, and don't quote me on that. She asked me if squash was in that group, but I think it is. Yeah, so here's the key about that. You just don't do it every single day. It's not that you can't. You just don't want to eat those foods every single. If you're having a lot of joint pain, you take them out for a little while, see how you do, and then you can rotate them back in. That's with any kind of food sensitivity for sure. Yes, ma'am. Mm-hmm. What's the process? Hmm. For sleep, to improve sleep training. So this young lady asked me if there was any magic that I knew about sleep. She struggled with insomnia for years, and her doctor advised her that there was something out there, which I'm not sure what it is, that was not available in the area that she would benefit from, and if I had any other ideas. Did I get that right? Okay. So sleep is one of those that is really challenging but really key and important. Of course, all the typical sleep hygiene, you know those things, right? You turn off the TV and blue light blockers. You wear the gray or the yellow sunglasses, the cool ones. Do you wear those? No? So blue light blockers are something really important. So if we have a lot of TV light, the blue light coming in, especially in the midday to evening, that actually turns off our melatonin production, so it can interfere with sleep. If you first, when you get up, get your eyes on some natural lighting, it actually helps stimulate melatonin production. So if you're not doing that, you should definitely be doing that. That is one thing. As far as programs, the one thing I can think of sleep training wise is a vagal nerve type stimulation, and you can order things online on Amazon. And they do have fancy centers that buy their own equipment, and you go in and they hook you up and it does its vagal nerve stimulation, but you can actually do it yourself. So it's called vagal nerve stimulation. The old way of doing vagal nerve stimulation for sleep is actually humming. And interestingly enough, when I worked in the nursing home, a lot of my patients, to calm themselves, were naturally humming, always humming. I hum all the time, and lo and behold, it's probably because I'm calming myself. But humming stimulates the vagus nerve. The vagus nerve when it gets sort of upregulated, it slows digestion, bowels slow down. It sends us into a fight or flight, and it also increases inflammation. So humming on a regular basis, interestingly enough, is free. So that's all I know. I don't really know of any fancy programs. I know there's sleep centers. Medication-wise, you have to keep trying different ones for people, but a lot of times hormones is actually one of the best things you can use for sleep. Hormones. that of which has evaded me in the last couple of years. Yes, ma'am. That's a good question. So she asked if tardive dyskinesia is related to brain function. So tardive dyskinesia, for those of you that don't know what that means, that's actually when the body starts doing involuntary movements on its own. So a lot of times it could be an arm flap or a leg goes out or things like that. Yes, there is a neurological component. I'm not a neurologist, so it's probably not best if I answer in detail, but from my experience, some medications actually are the biggest cause of tardive dyskinesia. When I was in residency, I prescribed Reglan to a patient for vomiting, intractable vomiting. It's what we were taught to use. And I came into the room and her arm was doing this. And I was like, yeah, that's not normal. So she said, what is going on? Like, it won't stop. And I learned quickly that Reglan is a good cause for tardive dyskinesia. And if it's not stopped, it can actually become permanent. So I stopped prescribing it because it scared the bejeebies out of me. But, there's a lot of medications that can be a cause for tardive dyskinesia. But yes, I do think there's a central nervous system component. Yeah. Lesions in the brain, there are certain areas that would affect other parts, that could present in different ways. Mm-hmm. Yes, ma'am. Yes? So I'll repeat it. Thank you. Yep, she's going to keep me on. Are you hired? Do you work for me? Keep me on track. She needs the wax out of her ear. Anybody a doctor in the house? Yes. The question was, I have a relative, a young relative it sounds like, that has missing genes, so gene deletions. Gene deletions are different than genomics because gene deletions are not just a little change in the structure, they're actually missing a whole component. So as far as changing that, you do not change their missing deletions. Now, the key is you need to have someone that is willing to say, okay, we know these are missing. It causes this sort of pathology and biochemistry change. How do we support the system to make it run optimally? You're not going to change the genetic deletion. If somebody tells you that, they're lying. You will not change the genetic deletion, but you can optimize the rest of the system to make up for that function, that dysfunction, okay? This type of stuff. So you want to look at genomics. They've already looked at genetics. They have deletions, right? We already identified that. But now you want to look at genomics. What else has been mucked up that we have control over? If I know she needs a fancy form of B12 based on her genomics, I give it to them. If I know that they do better with cold exercise because their mitochondria need it, then I tell them that's what they need. So genomics are things she has control over, or her family has control over, to optimize her deletional process. Make sense? Yeah. Any other questions? Yes, ma'am. Oh, yes, and yes. Hold on one time, and we'll come back. That's okay. She did. All right.
I've been diagnosed with Sjogren's syndrome. And as I age, I am getting so dry. I wake up all night long. My mouth literally stuck together.
Yep.
So my sleep's very interrupted, having a sip of water. Is that related to anything?
So that's related to what I have a passion about because I have an autoimmune disorder as well. And so with any autoimmune, question? Almost. Sorry, you didn't keep me on track. You're supposed to tell me to repeat the question. Just kidding. So the question was, if I have Sjogren's, which is an autoimmune disorder, and oftentimes that makes our eyes and our mouth dry and other parts of our body dry, it can get pretty miserable when it gets really severe. And she's having trouble because she's waking up a lot at night trying to wet her mouth. Otherwise, her mouth sticks shut. And so she's disrupting her sleep, correct? So the question was, is any of this related? Any autoimmune process has a root cause. Genomics is one part, but root cause is another. You need to look at gut. You need to look at inflammatory processes. You need to put out the fire, basically, so that the symptoms of whatever it is you have goes down. And so if you can control those things and you can manipulate that, then the dry mouth, the dry eyes improve. You have to really step back. One of the quick fixes oftentimes is higher dose omega-3, high dose omega-3. If you're not on a blood thinner, you can safely take fish oil or flax oil in high doses to help with dry mouth, especially with Sjogren's. And vitamin D needs to be optimized. That's huge. And that means optimal, not in the normal range. You guys are amazing people. If you're here, it's because you're not just average. So nothing about your lab should be average. If you come see me, you don't settle for average. We want optimal. So a vitamin D level that is normal could be 30. A vitamin D that's optimal per the literature is 60. Don't settle for average. It needs to be up. That would be my two big quick things that I would try first, but really is get to the root cause. Put out the fire as much as we can. Anybody else? Yes, ma'am. Oh, yes. Did you have a question?
This has to do with having a fall, getting up very quickly, and not being able to balance.
Mm-hmm.
And after that, I took Coumadin, turmeric, and
Verapamil?
verapamil.
Mm-hmm.
And now that I'm not taking those, they just fill me up a medicine bottle full, and now I don't have any. And I'm back where I was, and I don't know which one it was.
Okay, that's a good question. So she's having trouble going from a sitting to a standing position and when she was doing that, she was getting dizzy and even falling down, correct?
Right, yes, but it was getting out of bed.
Oh, out of bed to a standing position.
Yes.
So laying flat to a standing
Yes,
position.
right.
They call that orthostatic hypotension. So when you go from a laying position, you stand up really quickly, your blood pressure drops out and you go boop, or you get lightheaded, stars, and that kind of business. Some people can actually do it from sitting, and it stays a while. That's right. And if you're on the ground, So she said she had this happen, somebody gave her a concoction of 2 blood pressure medicines and, a blood thinner, a blood pressure medicine, and also turmeric, correct? Curcumin. Well, I'm going to guess she doesn't have a deficiency in blood thinner. Probably not the answer. Blood pressure medicine and control with the verapamil could have possibly helped because it keeps your blood pressure more regular and you don't have the ups and downs, the spikes all over. But it also, the curcumin, because we talked about it just now, helped with the inflammation. Probably that's one of the best things she could add back in safely. One of the things that usually causes that is a mismessage back to the brain to the heart. So you have this little weird connection going on. So before you get out of bed, before you even think about putting pills in your pill box, I want you to do a little foot dance. Move your feet up and down. Give your brain a signal that you're getting ready to get up because the signals kind of slow down. Yes, ma'am. So you want to bounce your feet up and down or wiggle your feet around or write the alphabet, and then you can sit up slowly. But if you go from a quick change in position and you have a slow highway connection, then you can go down really quickly because the body wasn't ready to adjust for that. That's my first thought. Hydration, too. Mineral hydration. Staying hydrated. Yeah, that's good. Any other questions? This is fun. I love this. Yes, ma'am. Oh. Yes, ma'am. Uh-huh. It is not because I waived that. You know why I did that? Boo. I know. Because they were telling me when I was in practice that I can only spend 7 minutes with my patient. And it pissed me off, to be frank. I couldn't get to know you. You can tell I like to talk. Super shy, I am. But I couldn't really get down to the root cause if I was only allowed 15 minutes max with my new patients. And so it really started to hurt my heart. I would be walking out of a room and someone would be halfway in the sentence and the nurse is knocking to get me to go to the next one. And I just didn't like that. In my practice, I can spend an hour and 15 minutes with you and nobody yells at me. I can spend 45 minutes on your follow-up and we can just shoot the poop or we can really get down to business. But really, nobody's telling me I have to hurry along. So I chose to opt out. I would like to be able to bridge the gap and be able to do it again. In my old practice, I did, but as I kept getting more and more patients, Medicare shut me to new patients, first of all, because my practice got too big. And then secondly, they told me I needed to see more people and speed it up. So it hurt my heart, to be honest. That's why I did it. So no, sorry. I know. Boo-hoo. It's cash. Boo. Yes, ma'am.
Anybody in Fayetteville doing what you're doing?
Not that I know of. I heard somebody using the buzzword of functional medicine, but I think their focus is a little bit more just hormones, which is just part of that. It's an important part, but I don't think it's that full primary care practice. Tim has good information on all the finances. I've actually been fired from talking about it because I started trading chicken eggs and deer meat. And once that happened, they said, no more for you. But the bottom line is you have access to the physicians or the clinicians within reason, 24/7. Like, in other words, you could send me a message or portal or text or call, and then I get back to you if it's emergent right away, because I check them, believe you, too many times a day. But we check them. But the other option is you can get in to see us regularly, and we're basically your beck and call for, what is it, a month? What's the charge, Tim? $249. So that includes, 20 some odd visits a year. And then you have access to everything else too. So anyway, that's it. We have x-ray there. I used to do urgent care and ER, so if you have basic things, cleaning out your ears is an easy one, by the way. Just kidding. But I'm really not here to tout that. I just wanted to share with you the information about a subject that you actually had dear to your heart. And I commend you for being here, being on the TV. Hey, out there. Oh, we have a question, and we're about done. Yeah. Mm-hmm. Yep. Yes. Yes, yes, okay. It's a wonderful question. So she has been watching the media, and she heard about Alice Walton's recent announcement to do the Whole Health Institute, and also in 2022 breaking ground on a medical school, which is awesome. And the cool part is it's not a traditional MD school. It's an MD school founded with the premise of integrative and functional medicine. So it's the first of their kind. The Whole Health Institute that she's also funding has to do with research for integrative therapies and functional medicine therapies. So they are putting everything that I've dreamt of into big practice for education. That's where it has to change. They have the money and the funding to do it, and the dreams and the insight. I did it on a much smaller scale in a small practice, but they have taken it up a whole another notch, and I'm super excited. I didn't know that. I was very fortunate, and like somebody said, call it luck, call it divine intervention. I came here 2 years ago when they were talking about it behind closed doors, and here we are. Super cool. I had no ties. It's just a blessing. Yes. No, I actually didn't know anything about it, which is really cool. And I honestly, this is how silly I am. I didn't even know who Alice Walton is. Sorry, I do now. No offense. But I did not. I had no idea. And so somebody kept telling me, talking about, this whole... And where was I, apparently? In Cleveland, for crying out loud. In Oklahoma. Yeah, so anyway, just a little country girl. That's not in my caliber, I guess. I didn't know anything about it. So, yeah, it's really been fortunate. It's a blessing. It's very cool. Because now I feel like I'm a little bit not like an odd duck trying to pave new paths and educate people. And I wrote a book for primary care physicians so that they could easily integrate some of this functional medicine into practice so they could help their patients. And so that it's a very cheap, inexpensive book, but the whole point is that we can do some little things. You don't have to know all the fancy stuff. You can do little things. Optimizing vitamin D. Omega-3s, high dose for Sjogren's. You can do so many simple things to change someone's health in primary care that we could be having practices that were flourishing and happy patients and happy doctors. And instead we're getting burnout, we're sad, we're tired. Patients can't get in to see us. I don't know. The system needs to change. So that's my book. That was what it's all about. So yeah, I'm right there behind them or with them or in front of them. I'm not sure. We're all together. Yeah, thanks. So anyway, yes. So there's a lot of, so the question was, got to remind me, okay, what causes neuropathy? Neuropathy has a lot of root causes, but some of the most common is when have you ever looked at wiring and electrical wiring? And you know how it has plastic that's around the outside so that when we touch it, we don't shock ourselves? So when that plastic on our nerves gets yucky or degenerates, then our nerves are kind of like, whoa, free and whatever. So choline, phosphatidylcholine, is something you can increase in the diet. Like there's foods that you can increase choline. That can help cover that myelin sheath. The other things that we know that can cause it are B12 and folate, but it's not usually typical B12. It's usually methyl B12 that's missing. And methylfolate that's needed. And so that actually, Metanex was a prescription that actually is out there. I don't like it because it's full of like dyes and soy, and you're not an Easter egg. You don't need blue dye, red dye. Like that's out. So, but methylfolate and methyl B12 is actually in that. So they were actually on the right track. They just added a bunch of poo-poo in it, and I don't write it for it. So anyway, but yeah, it's a lot of causes. Oh, another thing, fun fact, you know what celiac is? People know what celiac disease is, gluten intolerance, make you have diarrhea most of the time, blah, 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 blah. There's actually now we know that celiac, or the antibodies against gluten, can actually not just bother you GI-wise, but some people have antibodies against central nervous system called transglutaminase 6, or the skin. So that would be like it rashes from gluten. So you may not have the GI, you may not have diarrhea when you eat bread, you may not have bloating when you eat bread, but you may get skin rashes, or you may get neuropathy, or you may get what's called gluten ataxia. You're starting to walk side to sideways like the old V8 commercial. That's gluten ataxia. That's from gluten, for crying out loud. That's an antibody attacking the central nervous system, also peripheral neuropathy. So that's a new thing that we're not really aware of in traditional medical practices. Good question. Thanks. Yes, ma'am.
How about white spots on the tongue and they're wanting to do surgery?
Oh, okay. She says, how about white spots on the tongue and the only option seems to be surgery? Well, I'm not sure what kind of white spots we're talking about, but I wouldn't let anybody cutting on my tongue unless it was cancer and I needed to get that part out so that I could get my system healed and get back on track, maybe. If it's just a typical like a yeast white spot or a nutrient deficiency white spot or a gut problem, I'd fix all that first. Then I would definitely get the biopsy. If it's cancer and I knew it was cancer, I would say, okay, take that puppy off. What are my chances of it spreading elsewhere? If it's minimal, which usually it is. Spread? No spread? Yes, spread. Big spread. Then I would support my immune system the best I could, and I'd live my life like there's no tomorrow. Fair enough. There's actually a colleague of mine, Dr. Patrick Hanaway at Cleveland Clinic, that was diagnosed right when I left with stage 4 throat cancer with metastasis everywhere, and he has whipped it, and it was totally defying the odds, but he did it with a lot of the nutraceuticals, a lot of IV vitamin C. There's really interesting, there's some TED Talks and podcasts that he's done, and if I were you, I would get a hold of that information. He really did a good job with that and defied quite the bit. Hanaway, Hannaway, Patrick. Oh, that was too fast. Okay, Hannaway, Patrick. What's that?
We can show those
You can show those?
YouTube videos out too.
Oh, perfect. Yeah, so it's a good question. You know, what do you do when you're faced with the big C word? There's a lot of questions, a lot of choices. I would say optimize your health and optimize everything I could, including my quality of life. And I would look at all of my choices, and then I would go with whatever makes my heart feel at peace. And then I would hope I had a physician that would support me and a family that support me. Yeah, that's the perfect scenario. Thanks for your time, guys. Y'all have been so patient and so kind. I appreciate your questions. I'd come back anytime to teach you any subject that I have knowledge on. if you'll have me back. Thank you.